Salwa Faraj, consultant obstetrician and gynecologist, also found on True Men Online. Today I'd like us to discuss contraception, the one thing that no one wants to talk about. Now, contraception, what is it? Contraception is basically trying to avoid a pregnancy. This can be after delivery, before delivery. So which is the best mode of contraception? It actually depends per person. So when we talk about contraception, we talk about short-term contraception as well as long-term contraception. So short-term means you're actually looking at something like taking pills every day or having a patch every day or something like a 3-month depot injection. Now, when we're talking about long-term contraception, we're looking at irreversible as well as reversible. When we're talking about reversible, we're talking more about coils, which are intrauterine devices. There are actually two different types of intrauterine devices. One that is hormonal based and there's one that is non-hormonal based. And the other thing that we're talking about is irreversible long-term. When we say about irreversible long-term, we're meaning permanent contraception. So today I'll be focusing mostly on women contraception rather than men contraception. So we're talking about permanent women contraception. We're talking about bilateral tubal ligation, which is just a fancy name for cutting off your tubes and ensuring that the egg doesn't come down to meet the sperm. So I'll give you a briefing in terms of different types of contraceptions and what are the pros and cons. So we have hormonal options as well as non-hormonal options. So when we're talking about hormonal options, we're talking about oral contraceptive pills, we're talking about injections, we're talking about implants, and we're talking about hormonal intrauterine devices. These are just a few of the hormonal methods of contraception. When we're talking about hormonal contraceptives, they tend to have more side effects than non-hormonal contraceptives. This is because most of the hormones that are in these devices tend to release over a period of time. So you would actually have women struggling to actually try and conceive after maybe, for example, a depot injection, which is very common. This is because a depot injection is actually an injection that's injected into your arm and is supposed to last for 3 months. However, the effects in the system can go up to 6 months. So that would mean that you would actually have issues with trying to conceive because the main mechanism of like a depot injection would be to stop ovulation. Most of the hormonal methods actually work by targeting ovulation and ensuring that there's no egg that comes down to meet with the sperm. Now, if we're talking about implants are little devices that they put under your arm, and that could go for between 3 to 5 years. If it is 3 or 5 years, depending on what your family size and how soon you want to have a baby. So usually the side effects when you have an implant insertion would be headaches, high blood pressure, severe chest pain, irregular periods. This is all because as well as them being hormonal, they're going to mess up your usual cycle in trying to prevent you from getting ovulation. So when we're talking about now hormonal intrauterine devices, the main one that we do know is something called like Mirena. So this is a coil that is actually put into your uterus and releases one hormone. So usually we tend to use it for women who have very heavy periods. The only time we would actually consider a hormonal intrauterine device is usually when someone has not been able to adopt to the non-hormonal intrauterine device. So if you have very heavy periods or clots coming out, then the hormonal intrauterine device is the best option for you. The advantage about an intrauterine hormonal device is that if it bothers you, just grab the strings, by a doctor, removed, and you're back to normal. Let's talk about non-hormonal methods. We have the safe days, which aren't usually very safe unless you're using an app where you're tracking your cycles and your cycles are very regular. That's when we can say safe days are the best method you can use that have no hormones, no side effects. However, the main big side effect with using safe days is pregnancy. Number 2 we'll talk about with non-hormonal methods is an intrauterine device, which is the copper coil. Now, usually with the copper coil, if you have multiple sexual partners, or if you have very heavy periods, or you're a person who gets very recurrent infections, or very painful periods, I would really urge you to shy away from the copper coil, because that would just mean your symptoms would get worse. For more information on any of our contraception methods, please don't hesitate to contact us. We're more than willing to help you make sure you don't have that baby that you don't want.